Hello and a warm welcome to another edition of To The Point. On the show this week, we have Union Health Minister Jagat Prakash Nadda. Welcome, sir, and To The Point. Let me begin with the new medical health policy which was recently launched by the government. It talks about a strategic purchasing of the secondary and the tertiary care. What does this exactly mean, and how are you really going to synergize the private and the public sector?
First of all, I tell you that the need of having a new health policy was that in the 2002, the policy was centered around regulation and was centered in disease management. This health policy brings preventive and promotive health care. We are going from रोग से निरोग cure and universal health care. Keeping that factor in view, it becomes essential that in past recent years, private sector has also grown to a larger extent. That was also taken into consideration. So, wherever there are gaps, because we try to give health or when we say that we will go for universal health care, that means we want to serve 1.25 billion people. And the capacity of the public sector or the state sector cannot be to that level. So, till the time we are not able to reach, or wherever the gaps are, that gaps should not deny the individual from getting the health services. So, we have said strategic engagement and strategic purchasing of the private sector, so that the patient we should not say that we can't give you this facility. We will say that this facility is not with us, but we will arrange for you and we will see to it that the financial part is taken care of.
But Mr. Nadda, we've seen that 70% of the country's need at the moment, health needs, are fulfilled by the private sector. And what about things like accreditation, quality control? We've seen that the private sector has almost grown at an unregulated pace for the kind of resources they have brought in. So, how are you really going to bring a check on things like quality control, accreditation, monitoring? All these things will be checked.
No, as far as the public health is concerned, when we engage any private organization, it has to be NABH and NABL accredited institution. So, whatever we give or whatever we engage, which we call as the strategic purchasing or strategic engagement, in that we see to it that they are NABH accredited and NABL accredited. So, quality control is done. But at the same time, we have come out with a model code bill, which is Clinical Act, Indian Medical Clinical Act. This act has been enacted, and it is for the states, because health is a purely state subject. So, the states have to adopt it, and 10 or more states have adopted it. We are trying to see to it that maximum states adopt it and implement it. If it is implemented, we are trying to push through or trying to convince them that you should go for this clinical act, which is going to improve the quality of the private institutions. That is going to work. And of course, there is an incentive that if you accredit yourself and if you do a quality work, your engagement with government will be there. There are many programs which we have started,
but
like the program called as Pradhan Mantri Dialysis Yojana. Now, in this Pradhan Mantri Dialysis Yojana, we are giving free dialysis facility to all BPL people, and this is in PPP mode. So, if you want to enter into this field, approximately 900 crores are being spent by Government of India per year on this program. More than 300 hospitals have taken this program and it is working. More than 10 lakh dialysis sessions have been done, and more than 1 lakh patients have been admitted in this Pradhan Mantri Dialysis Yojana. But all this has been done by the private sector, and the incentive is that you have to maintain the quality, and if you maintain the quality, we will engage you.
But why are experts and analysts, when they have seen the medical health policy, they are saying that it points towards an over-dependence on the private sector, and instead of the primary health care, it's going to be the private healthcare providers who will benefit out of this policy?
I think this is not correct, and practically every section of the society has appreciated the new health policy, and they might not be knowing that we have said about universal health care, and in universal health care this government assures that we will provide free drugs and diagnostic facility, and this free drugs and diagnostic facility is to be given at the PHC level, at the sub-center level, at the CHC level and at the district level. So till district level there is no tertiary health care, it is only the primary and the secondary health care, and we are giving them free drugs and diagnostic facility. Approximately 37 medicines are given at the sub-center level, approximately 10 types of tests are done there, some 250 medicines are given at PHC level, some 300 plus medicines are given at CHC level, and 600 plus medicines are given at district hospitals. All these medicines are to be supplied free to the people.
From what you are saying,
so that means that we have not allowed to let our people depend on the private sector, or we are depending too much on the private sector. We are working on their own. Only the word is used is engagement where to fulfill the gaps, and gaps is not the major share. The major share is with the public sector and with the government of India.
But when you talk
with
about
the government of India plus the states.
But when you talk about this strategic partnership or the strategic buying, when you say, there is already we've seen that there is an existing arrangement, like you have an empaneled set of hospitals which are there associated with the public sector. Is that arrangement something which is different, or this is something which is completely different?
More exhaustive we will make it. More exhaustive we will make it. And private engagement means, you see, one is that you send the patient to an institution where he is taken care of all the things. Okay. But here we also mean that we can take partly a help from the private sector. Okay. Like if one of the diagnostic facility we do not have in our hospital. So the patient can be sent to that particular institution, get the test done, and that is the private engagement.
Okay, but what about the expansion of insurance? You said that it talks about the universal health care, but what about things like expansion of insurance? How do you look at that aspect?
We are going towards assurance. Okay. Like the mother, the moment she becomes pregnant, right from that very point, we start taking care of all her medicines, okay, all her tests, all her prenatal tests, antenatal tests, and then postnatal tests. After the child is born, we give them all types of immunization program. 12 types of vaccines are being provided. After that, and also all types of supplementation is given. Pre-birth and after birth, the child and the mother both together. And we do this till the child becomes adolescent. So we have adopted a life cycle approach. We go for universal screening. Now, universal screening we are introducing in 100 districts this year, and very soon we will be having in all districts universal screening, which will have blood pressure, diabetes, hypertension, hypertension, cervix cancer, breast cancer, oral cancer, all these will be checked. So we are going towards an assurance model. Then we are also going where we have started Rashtriya Bal Swasthya Karyakram, where we go for delay, deficiencies, defects which the child develops, and all are being treated, and rehabilitative program is also done free of cost.
So basically it's an assured, it's an assurance of the primary care. But what about the secondary and the tertiary
I told you we will engage private wherever we are less, but as far as the secondary is concerned.
What about the catastrophic costs which we see in the secondary and the
we will arrange for it.
Okay.
That is how we are going to go for a strategic engagement of the private partners. This is the policy.
Okay. What about, like when you talk about the universal health care, we've also seen a poor country like Thailand, which has almost achieved 100% universal health care. By when can you say that India can actually reach a level like that?
First of all, I am very against comparing India with any country. This is a wrong notion, and this is not correct to see India in the right perspective. It's a democratic country. Now people start comparing with communist countries or other countries. It's a federal state.
No, because health has had a bad legacy in India.
It's a federal state. We take care of 1.25 billion people. States like Uttar Pradesh is the 5th largest in the world, which includes India also. So our country is uncomparable. We have to see it from our own perspective. And when I see from my own perspectives, we have got very positive aspects which has to be understood. Now I'll tell you how. How robust is our health system? That we are polio free. Lakhs of people are coming from Pakistan, going and coming. Our National Center for Disease Control and Integrated Surveillance Disease Control Program is even able to see to it that if there is a dormant virus of polio in sewage, that is also taken care of. And we are polio free. And India, when we talk, where is Leh Ladakh? Where are the jungles of Bastar? The tribal area of Gadchiroli, the far-flung areas in the tribal area. We have become yaws free. Now yaw is a disease which does not take place in cosmopolitan or metropolitan cities. It takes place in tribal area. If WHO has certified us that we are yaws free, that means our workers have gone to the tribal areas, in the far-flung areas, and taken care of that. We are maternal and neonatal tetanus free, certified by WHO. Now this means every year more than 2.10 crore mothers get pregnant. More than 2 crore children are born.
Certainly what you're saying.
See the volume. And if we are neonatal, maternal, tetanus free, these are very good indicators which we have to understand in context with the size and the people whom we address. I will, the most positive aspect I would like to share with you, that the infant mortality rate of the country, the maternal mortality ratio of the country, the total fertility rate of the country, the under 5 mortality rate of the country is declining faster than the world base.
But if you make the comparisons,
they are talking about 10 million, 20 million people. We are talking about 1.25 billion people.
Right. No, certainly.
But at the same time, if our pace is faster than their pace, that means, and I must salute my health workers who have taken care of this.
But when you talk about these kind of health indicators and you compare it with the 1.5 billion population of India, the new health policy also talks about an increased spending in the public health expenditure, that is about 2% of the GDP. Don't you think that when you look at the population, that figure is really insufficient?
These are all wrong notions which have developed here. You see, the moment I became the health minister, I was told that there is a slash in the budget, things like that. We have to increase the capacity to spend. The states are not able to spend. The money is lying with them. Funds have never been a problem. You see, when we can,
but most of the states have been crying foul that they have not had resources.
I can give you a list. I can give you a list where the funds to the tune of 500 crores to 150 crores are there in their kitty, which they have to spend. It has not been spent, and the moment they spend. Now for Pradhan Mantri Dialysis Yojana, we have got 900 crores. Only 300 hospitals have come up. We want that at least every district hospital should come up. So we have a budget for 600. Budget is not the problem. The problem is rightful capacity to spend it.
So would you,
dismiss? What about immunization program? Can you imagine that we had reached only 62% of immunization? So fund is there for 100% and we raised it to 67%. There was an increase of 6 to 7% a year in 2015-16. So funds is not the problem. And we are entering into this program and we are going to increase in it. The devolution of financial power from the center to the state after the recommendations of the 14th Finance Commission.
So this increase in the 2% GDP, like 2% of the GDP, 2.5% of the GDP you are looking at is in a phased manner, or you do it right away?
In a phased manner.
Okay.
You see, we can give it right away also.
But when you say phased manner, Mr. Nadda,
you can see, we can give it in the right away also. Right. But the capacity to spend, you see, जब लौट के आ रहा है पैसा और हम बोल रहे हैं इसको खर्च कर दो, तो देना वही है ना. You see, for the first time, पहले the budget expenditure was always more than the real expenditure.
But the moment you say it's going to come in a phased manner, it's the health skeptics who start saying that, you know, this is the kind of promise which we've had from the last 15 years. What is the kind of change they give?
The reality remains that we have increased the immunization by 7%. The reality says that we have entertained 1 lakh dialysis patients free of cost. The reality says that 10 lakh patients, 10 lakh sessions of dialysis have been done free of cost. The reality says that we have offered to every state, make a program where free drugs and diagnostic facility will be given, where some 40 to 50 tests at the district level and some 700, 600 plus medicines will be given free of cost.
So, when you talk about the additional resources, which obviously will be needed when you are propping up the state infrastructure, the central health infrastructure, you're talking about institutes like AIIMS which are going to come up across the country. From where are you going to mop up the funds? Because are you going to ask the states to...
Our Prime Minister Narendra Modi ji has the health agenda is one of the topmost agenda. And health has never been the problem. The finance ministry says that give us the program and we'll give you fund you. And that has been done. Three programs have been added, and these programs have been added where the fund is like for example, now we have come out with AIIMS in Kalyani. We have come out with AIIMS in Maharashtra, Nagpur. We are coming AIIMS in Assam. We are coming AIIMS in other parts of each All India Institute of Medical Sciences costs, the capital cost is 1,000 crores. So when we start the work, the funds have been provided, and that is the commitment of the government. And 6 AIIMS are now new AIIMS have come up, and we are enhancing, we are making it in the phased manner. So how do we do it? Because our Prime Minister, Shri Narendra Modi ji, our finance minister is committed to spend money on health.
Coming back to the strategic buying or the strategic purchasing, when you talk about purchasing of the services, is there going to be a separate, some kind of a national organization or some state organization which is going to do this purchasing, which is going to, you know, have legislative powers to carry that mandate? How are you going to do that? What is the procedure?
We don't want to increase institutions.
Okay.
We want to maximum governance, minimum government. The National Health Mission has got all its systems in place, which can take care about this strategic purchasing. It is a tendering process. The details of the tenders have been worked out. The private organizations have to come in. They have to enter into the program, and accordingly we will be giving the money to the states, and states will be further giving to them. There is no need of any authority or an organization or something. All will be done under National Health Mission.
There are many skeptics who are saying that, you know, when it's a private provision and a public spending, it is ready for a disaster. That kind of a recipe is ready for a disaster. Would you dismiss this?
I am optimistic about it, and the experiences have shown that we have given very good results, and we will do it in future also. Need not to be skeptic about it. Need not to be skeptic about it.
Taking you away now from the health sector towards the larger politics of BJP, after the recent win which has been seen in the assemblies across the country, the 5 states, what is the larger game plan of BJP now? How are you looking at the larger battle of 2019?
See, as our Prime Minister has said, that we never look in terms of elections. We never look towards elections. We look how we can make India stronger, how we can see that the people of the country are best taken care of. सबका साथ, सबका विकास, और एक सशक्त भारत की कल्पना है. And for that, the common man, how we can give more and more service to him, how we can make his life more meaningful, how we can make his life more secure. Now, Prime Minister has been talking about in 2022, New India, that New India aspiration where we have to work and see to it. So, we don't see in terms of elections, we see in terms of how we can give the best to the people, and the results have also shown that these results have shown that they have shown faith in Modi ji, they have shown faith, they have the hope from Modi ji, and because that is why these results have come, and that is the larger, if you talk about in terms of game plan, I don't say it's a game plan, it's our national service for which we have come.
But a number of factors have been taken into consideration. If you look at the recent victory, it was the issue of nationalism, obviously good governance, leadership of Modi ji, all these factors were a combining factor. And but a lot of people have been saying that it has been based more on propaganda. So don't you, does this thing not worry you that maybe after the end of, let's say, like for example, say after 2 years, people would maybe try to dismiss these kind of things, and they would have their faith, which is more like a dilute factor?
You also remember that in 2014, post 2014, such type of arguments had come. Practically before every election, these arguments come. This support is not because of propaganda. This support is because of the honesty, integrity, and the faith in the leadership of Modi ji that has converted the poor people to vote for Bharatiya Janata Party. And this is the reality. And in coming times, you will find that this faith is going to increase more and more because of his dedication for the poor, for the left outs, for the people who are standing on the last leg of the society, those who are in the last. He has talked about Antodaya. The person who is standing at the last, he should be helped, she should be helped, taken care. In health sector also, you see all our programs are towards people who do not get the facility.
Party President Amit Shah has been saying that he will make this country into a Congress Mukt Bharat. Every day we are hearing names from other parties who are joining BJP. Is this going to be a new strategy for BJP, which we have seen in the past elections as well? A lot of people from Congress joined in Uttarakhand. Then a lot of people from other states also, which were from other parties, joined BJP. Now you have crucial elections coming up in states like Himachal. Then you have Orissa. Recently you had a national executive over there, and there were reports that BJP is trying to make inroads into the states like these. Are you going to resort to the same strategy where you will be breaching the fortresses of other party?
You see, when you mean about Congress Mukt Bharat, it is not about a political party. It is the Congress is a culture. We have to get rid of that culture, and that culture was synonym of many things. I would not like to point out, but it had become a synonym of corruption. It had become a synonym of indecisiveness. It had become a synonym where they were talking about the poor and working for the for the rich. So Congress Mukt Bharat means the mukti with this culture along with the party. Number one. Number two, there were many in the Congress who were not feeling comfortable. Now they have got an opportunity, and we have to see to it that India goes stronger. So people who would like to come for that very reason, we welcome them. For a larger cause, we don't want to segregate people. Sabka saath, sabka vikas. So sabka saath, if you want to come, we will take your saath.
But looking at the profile of the chief ministerial candidates who've just become chief ministers in states like UP, Uttarakhand, Manipur, most of the chief ministers we've seen have had a strong backing from the RSS. How much of hold really does RSS have at the moment? Is BJP stronger or is RSS stronger at the moment?
You see, all chief ministers are BJP chief ministers.
Okay.
And they are BJP chief ministers. They work accordingly.
So RSS
is our ideological support. So in the broad sense, people are influenced and they have been directly, indirectly associated with RSS. But our course of action, our course of thinking is decided by Bharatiya Janata Party, and all chief ministers are BJP chief ministers.
So to have an RSS backing is not a prerequisite for a leader to become chief minister?
See, what I will say is that it is their individual choice. Many are there, but all our chief ministers are BJP chief ministers, and most of them would like or have an ingredient in them which supports the RSS ideology.
Many skeptics, again, I would use the word skeptics only, or the so-called the secular lobby of the country, which they claim of. They say that RSS obviously will be emboldened now with the kind of mandate which BJP has got, and they will try and impose a Hindutva agenda. They will try and bring in things like Uniform Civil Code and Article 370. All those kind of issues will be coming. Then cow protection obviously is one big agenda which we have seen in UP as well and across the country. Do you think that the front staging of issues like these, does it really isolate the minorities, especially the Muslims?
No, you see, those people, all those who have been talking like this, they have always tried to disturb the secular character of this country. Okay. BJP has been ruling in many states for long, and the track record says that they have worked with the principle Sabka Saath, Sabka Vikas, and that we are doing.
But what about the political representation of Muslims? We don't see many faces from Muslims. If you say Sabka Saath, Sabka Vikas.
As far as possible. You see, we fight elections to win, and we have to see winning candidates.
Coming to Himachal Pradesh, elections would be held soon in that hill state. There were reports that you would be going there as a state president. So, are we looking at Mr. Nadda as the prospective chief minister of Himachal Pradesh?
See, you will have a BJP chief minister there in Himachal Pradesh. Okay. And BJP is coming to power. I am very much involved in my health activities here, and it has keeping me busy. And I being from the party cadres, the type of work which I get sometimes as Kerala in charge, election in charge, Uttarakhand in charge, it keeps me busy, and I am happy with it.
So, you are not one of the front runners for the CM post in Himachal?
I have never been a runner anywhere, anytime. Although I am a sportsman and I was a sprint runner, but in politics I am not a runner.
Thank you so much, Mr. Nadda, for coming on To The Point. So that's it on this episode of To The Point. See you next time with another personality. Goodbye and thanks for watching.